Welcome to Real World Perspectives on Policy Solutions. I'm Trevor Bechtel, facilitator of this series with Poverty Solutions at the University of Michigan and instructor of the course that accompanies the lecture series. Over these 7 weeks, we're introducing the key issues regarding the causes and consequences of poverty in this virtual space, featuring experts in policy and practice from across the nation. We're an audience of students enrolled in a course, community members, academics, policymakers, and interested people from Southeast Michigan and beyond. And we're really excited about this session with Dr. Khaldun and Lieutenant Governor Gilchrist. But before we dig into this conversation, I want to remind our viewers that we want to hear from you. You can submit questions in the comment box to the right on YouTube or on Twitter using the hashtag #PovertySolutions. We have several questions from students in the course to get us going, and we look forward to a meaningful conversation, and we'll try to get to as many of your questions as possible. We welcome an open and respectful dialogue, and I want to let people know that we will be responsive to any inappropriate content. I invite you to check out our resources, tune in for additional events, and find other ways to connect with other poverty research at our website, poverty.umich.edu. So with that, I'd like to introduce my colleague, Luke Schaefer, Director of Poverty Solutions, author of $2 a Day, who will introduce our speaker.
Hi, everyone. I'm Luke Schaefer. I'm the Director of Poverty Solutions and a faculty member at the School of Social Work and the Ford School of Public Policy. And I couldn't be more excited to get to be the interviewer, the moderator for this great session that we have today with two people who I have admired for a long time. I'm actually such a big fan of Dr. Khaldun that I put on a suit jacket for only like the third time during the pandemic. So Dr. Khaldun is the Chief Medical Executive and the Chief Deputy Director for Health at the Michigan Department of Health and Human Services, where she provides medical guidance for the state of Michigan and oversees multiple administrations. Prior to that, she served as the Director and Health Officer for the Detroit Health Department. She's also been a doctor for the Henry Ford Health System. And I could go on and on about her bio, but I'll just wrap it up by saying that she's an Ann Arbor native and a graduate of Pioneer High School. Dr. Khaldun, really a pleasure to have you with us.
Oh, thank you. Thank you for having me. Looking forward to the conversation.
So I'm sure your work life changed enormously in unexpected ways when the COVID pandemic struck. But I wonder if just for a minute before we get to that, you could talk about your agenda before that. You had moved from the city of Detroit into the to the MDHHS. What were some of the biggest issues on your mind? What were some of the things that were on your agenda that you were hoping to work on?
Yeah, so thank you for asking that. And it's nice to be able to take a moment and go back. So when I started the job at MDHHS back in April of 2019, which seems so long ago at this time.
Another lifetime.
Yeah. Another lifetime, right? But I was really excited about the prospect of improving the health of all Michiganders and really integrating, again, you talked about, the administrations that I get to work with at MDHHS, integrating policy and public health across the life course. So aging services, how can we think about promoting health for entire families? And so some of the things that we were working on, and quite frankly, are still a part of our priorities, are maternal and infant health, and making sure that every baby, every child that comes into the world is born healthy, to a family that has the right appropriate supports, making sure that child grows up healthy. So lead poisoning prevention, for example, and thinking about primary prevention, so not waiting until someone already has been exposed to lead. Thinking about social determinants of health. So again, many people know it's not just healthcare or doctors that drive health. It's really primarily things that happen outside of a doctor's office. So those are some of the things that we were really focusing on. And quite frankly, they're even more important now with COVID-19.
Yeah. Let me just do one follow-up on that question, which is, could you just give us a sense of the different administrations, just some of the sort of different parts of the department that you are in leadership of?
Sure. So the Public Health Administration, which is primarily where I spend most of my time these days, obviously. So that's all your general public health work, immunizations, epidemiology, those types of things. Behavioral health and developmental disability. So we have a network of behavioral health across the state. We also have psychiatric hospitals that we oversee. And then Medicaid, the Medicaid program, and then aging and adult services. So those are all of the administrations that are under my umbrella at the department. And we have great leaders within all of those administrations who really keep the work moving.
So you're really talking about millions of people who either get Medicaid or get services or are impacted by the programs that you are in charge of.
Yes, it's an honor. It's a lot, but again, we have a great team. I love being at the level where I can guide and support the leaders in those teams. But absolutely, it's a lot that we oversee.
Can you walk us through the first week or two when things really began to change as it relates to COVID? What kind of data were you looking at? When, I'm just thinking of like the West Wing type play-by-play of what it was like to be you during that time. Maybe when was the first time you had a sense this was something bigger, or, what were some of the first sets of decisions that you had to make?
Well, I'll tell you, I was on the beach during my winter break. During my winter break, I remember speaking to my husband and saying, "Uh-oh, excuse me, something's going on in China. We need to really pay close attention." And then, sure enough, in January, when we started seeing, we started learning more and more. So at first, people weren't sure if it passed from human to human. Very early on in December, we weren't sure what the information was. But essentially, by the time we had confirmed cases that were coming more in the western part of the country, we knew it would be just a matter of time until it came to Michigan. And quite frankly, when I learned that we had very strict testing criteria across the country, when I remember talking to my team and hearing that they had been in a meeting where they were told that only people who were very sick, people who were hospitalized, people who had recently traveled will be able to get a test, there's no question in my mind that that meant that we were not going to be able to detect COVID-19 quickly enough, and it was likely going to spread much sooner than we will be able to catch it.
And that was a supply issue, that there just weren't enough tests, that particular decision, guidance was coming down?
Yeah, that was certainly not something that was driven at the state level. That's something from the federal level. Initially, the CDC, we had to wait for them to be able to test. You may recall back in January, we would put out these releases about people being persons under investigation. And so we would have to arrange for people to be sampled. They'd have to be approved by the CDC to be tested. And then we'd have to send it down to Atlanta and then wait for the results. It wasn't until the end of February that Michigan and other states were actually able to move forward with testing themselves. And then I think we aggressively expanded that testing capacity. But that's something that was really driven at the federal level.
Talk to me a little bit more about that sort of expanding the testing capacity. What does that look like, and how does the state work? Are we talking about working with hospitals, the cities? Just walk us through that a little bit.
Yeah. So, so basically, and I'm not a lab, specialist. We have lab experts. Certainly, we have one of the top state labs actually in the country, right here in Michigan. So we basically had to get the right kits and the things that would make sure that we could be able to test here in the state. And then what we essentially did is work with hospitals, private labs, to be able to essentially validate them being able to come on board with doing the testing as well. And then it was a lot of trying to get additional testing supply. So it's not just about the test done at the lab. You need to make sure there's enough swabs. People needed enough PPE, so masks, the personnel who were doing the swabs. You have to think about medical personnel. You have to think about transportation, reagents. There's so many things. And then the person who's getting the test done, all the steps that it takes for them to actually get their result back. So there's a lot of work that's needed to be done to make sure we expand our testing capacity. And I'm very proud of us. We initially were testing 5 people a day, and now we're testing 30,000 a day. And so I'm very proud of the work we've done.
What were some of the other sort of policy choices or decisions that you had to make early on?
I worked very closely with the governor, obviously, very early on, letting her know how serious this was, letting her know, again, this is not the flu, this is not the cold, this is not a cold. There's only certain things in those community mitigation measures that we all know very well now, social distancing, wearing masks, washing hands. those are really the only things we had. And so we had to think quickly about how we could support Michiganders in being able to do those basic things to protect themselves. But I think, again, those social mitigation measures, making sure we expanded testing as quickly as possible. One of the things that I was able to do, because we were so aggressive at expanding our supply chain for testing, I was able to expand quickly, as quickly as I could, the number of people who could actually get a test. So instead of it being people who were very, very ill, we expanded it quickly to people who had mild symptoms, people who had no symptoms, and that was very, very important.
Right, because that sort of allows, because we now know that people are contagious early on, right? And so the testing allows us to sort of get them to quarantine and protect others.
Well, it's important to emphasize, though, once you're a close contact, you can't test yourself out of quarantine. But what testing does do is allow us to quickly identify who has the disease, quickly reach out to their contacts, and tell those other people that they need to be quarantining as well. So it's really important.
So as the pandemic evolved, it was clear that there were major racial disparities in who was impacted. What can and did the state do to address those?
Yeah, I'll be honest with you, it's really unfortunate, but not surprising what we found when it came to the racial disparities in COVID-19. And I think the very first thing we did, which was very important, was to just measure it. If you don't measure it, if you don't identify it, you can't address it. And so that's something that I had worked with my epidemiology team to make sure we were looking at COVID-19 cases and deaths by race and ethnicity. And so once we identified that, we saw some alarming things. African Americans make up 15% of the Michigan population, but they were 40% of deaths and over 30% of cases. And so from that, we were able to act. Lieutenant Governor, just an excellent, amazing leader. It's been an honor to work with throughout this pandemic. The governor announced the Racial Disparities Task Force. We've been working with communities to make sure we're driving decisions and programs and targeting our communities of color so that they have the supports they need.
And I just read some pieces last week that I think from Professor Deborah Khaldun, who suggested Detroit actually was overrepresented among cases and deaths early on and is actually underrepresented in the last few months, that actually the cases are lower than the state average. That seems like a striking improvement.
That's right. And we continue to track the data, but over the past couple of months, what we've seen is that that disparity I talked about early on, particularly among African Americans, has really gone away. And so African Americans are not overrepresented in new cases and deaths. And so I think, again, there's much more to do. And quite frankly, we need to do more analysis on why that may be. But I can tell you the things that we did as far as targeted messaging, making sure that communities color got the important messages, making sure we expanded testing and eliminated barriers to testing. So a lot of the work, especially, again, kudos to what happened in the city of Detroit with the mayor, the Detroit health director, expanding testing significantly. We worked with many partners to, we actually put testing sites based on social vulnerability index across the state, actually, and expanding testing, and then also making sure testing was free for those who needed it.
So when I think about the type of work that you're doing as a policy response, you're sort of watching the scientific guidance of what we know about the virus and how it spreads and how we can protect ourselves. There's a lot of coordination across all these levels of government with your team and you, where you're, working with the city of Detroit on their expansion of testing. And then there's like a lot of stuff too, right? You're talking about like testing, knowing we should test is one thing, but like getting out in front of the supply chain, that's sort of another major piece of the puzzle, right? Making sure we have the stuff that we need to do what we think we should.
That's right. There's a lot that goes into my role. There's looking at the data and the epidemiology, of course. There's also providing guidance and thinking about the policies that we can actually implement to address the spread. But then there's just the operations of it. And again, a lot of my time is also making sure we're moving forward with things, for example, flu vaccination efforts. We're planning for the COVID vaccine. So there's a lot that goes into the response, and we have an amazing team that's moving it forward.
So last week we had 4 of America's mayors discussing the crisis and changes in the last 6 months, and they offered some arguments that cities are where you should go to get things done. And I was just thinking of you as someone who's worked at a high level in both city and state government. Sort of, how do you compare sort of the two, and you know, what's been your experience in those sort of 2 different levels of government?
Yeah, you know, I've enjoyed both of my roles at the state and the local level. I think what's really fun, quite frankly, about the local level is you really get to understand the needs of the community
Hmm.
and tailor policies and programs to what those communities' needs are. I
Hmm.
mean, quite frankly, some days I miss walking around my clinics at the Detroit Health Department and interacting
Hmm.
with the nurses and the people who are really on the front lines doing the work. But absolutely, cities are incredibly important in driving forward the work of public health and health policy. But I'll say, that, you know, at the state level, and what really excited me about the role was being able to drive those broad system
Hmm.
changes and those policies that can really impact broad communities. So, for example, I'll talk about the opioid epidemic. I actually, you know, got some funding and kind of launched some opioid programs at the Detroit Health Department. But when I got out into the community and I heard what the challenges were they were facing, one example was prior authorization in the Medicaid program, where someone had to basically call their insurer first in order to get a very basic medication that could potentially save their life. And so where does that come from? That comes from state policy.
Hmm.
That comes from Medicaid and then someone basically just making a decision. And so, you know, one of the first policy initiatives we did when I got to this position was remove prior authorization for Medicaid for medications that support opioid treatment. And so again, those high level policy initiatives are really fun to do and think about at the state level. And you can have a broad impact on a lot of people's lives at the state
Hmm.
level.
So in city government, you can be a little closer to the communities you serve and really sort of develop programs that are tailored to their needs. And at state government, it sounds like you can sort of impact the policies in which all of those cities work. So you can broaden that
Absolutely.
impact.
Absolutely. And I would just add, I do think it is very important at the state level to listen to stakeholders and
Hmm.
communities because
Hmm.
you are a little bit more removed from the on the ground work. I think that's an incredibly important part of the job at the state and the federal level, quite frankly, where I did
Hmm.
spend a little bit of time as well.
We had a question. There are a number of technological solutions proposed to help governments with contact tracing, and we wondered sort of what does that look like in Michigan? Is there any sort of technological assist, maybe not a solution, but something that can help us in a state like ours?
Right. So I'll just start by saying, you know, the public health data and technology infrastructure, even though us in public health knew that it was a little bit outdated and certainly not as developed as what you may see in a healthcare system, it certainly has shown that it wasn't quite ready to respond to a pandemic of this magnitude. And so we have really aggressively worked at MDHHS and with other partners to expand and develop our technologies. Everything from how a lab test comes
Hmm.
into our system to how health departments are getting data back to us. But to your question about the contact tracing, absolutely. I think there are opportunities for us to use technology to guide and support our efforts on contact tracing. Again, that's one of the most important things that we can do to prevent the spread of COVID-19. And so we'll be talking more about some of those initiatives out of MDHHS in the upcoming weeks. But I will say, I think it's also important that when we think about contact tracing and technology, that we also consider things around privacy, right? Making sure that people, if nothing else, feel that their data is secure. But absolutely, we have to make sure their data remains secure. But also making sure whatever message and notification is coming through that particular technology, that we understand the public health implications of it. And so, what do I mean? There's applications out there that, you know, if you've been within 6 feet of someone, it could potentially ping you and tell you you've been in 6 feet of someone with COVID-19. Well, you know, in context, we need to think about that. Is that someone who was in a completely different office, you know, on another side of a wall?
Right.
Were they in a car, you know, driving by you? So it's important that we use technology, but that we also think of it in the public health context and integrate both of those things together.
We got an interesting question from Joneigh. Americans are increasingly presented with different media narratives about many things, including public health. And listening to you to talk about your work, some of it is about communicating, right? And figuring out how do you get messages out, evidence-based messages. Can you talk a little bit about what kinds of strategies you've used to try to communicate in a state like Michigan that is just so different in some places, while, you know, the same in other ways?
Right. Yeah. So communication is just very, very important. Obviously, there's a mantra that, you know, comes from the CDC in public health crisis leadership. It's be first, be right, be credible. And so that means, you know, when a crisis is developing, and certainly as it's ongoing, you have to make sure you're really getting out into the community, that you're letting them know what information you have, and quite frankly, what information you may not have. And I think that's been part of the challenge with this crisis is we're all across the entire globe. We're learning more and more about it every day. Things sometimes change. And again, that's science. Things change. We do research, we learn, and then we may change guidance later on. And that is just what medicine and science is, quite frankly. But communication is incredibly important. I also think it's important that the communication not just come from Dr. Khaldun, the chief medical executive, but it has to come from trusted leaders in communities, whether that's other doctors, faith-based leaders, schools, whoever it may be.
Intermediaries.
Intermediaries. And it's really important that those messages also flow through those channels.
We got a question from Michaela. Does the state have any sort of role in helping Michigan universities navigate their plans to come back to school? How has that changed? How has that relationship among all your stakeholders look like?
Absolutely. So we have been supporting and I'm not sure if it was about K through 12 schools or universities, but we've been supporting both. And making sure that they have the plans and the infrastructure in place to be able to bring students and children back to school safely. So I've met with many university leaders. They always know how to access us as far as help with testing. I'm actually partnering with several universities on things like flu vaccination clinics. So between the health department, the state and local, quite frankly, health departments, which play an incredibly important role in all of this, we are supporting schools and being able to navigate what the data means for their local communities, what that means for their plans on the ground as far as how to bring their children back. So it's complicated, but we are supporting them.
I wonder about the role of scholars and researchers with expertise in public health and other at Michigan's universities. Are you able to utilize them in any way in your work?
Oh my gosh, yes, the university leaders have been incredibly important in our response. And I think that's a really important point. I always say the work of public health is not just about the work of the public health department. A health department and government plays often a very central role, but we have to use all of the great expertise across the state. We have been working with all of the three major universities, Wayne State, Michigan State, and the University of Michigan, really throughout this entire pandemic. And not only just supporting them on their actual campuses, but also getting input and feedback on how we roll out this response. We have not made decisions in a vacuum. We have absolutely consulted experts, public health experts across the state, across the country, quite frankly, to help guide our evidence-based, science-backed decisions that we've made as a state.
You mentioned when we were talking about the racial disparities that came out as part of through COVID that wasn't really surprising. And we've heard some public health officials sort of make the case that racism, structural racism, a public healthcare crisis. These officials connect sometimes to the Black Lives Matter protest and report very little disease spread that has been linked to the protests. I wonder just what are your reflections on the connections between public health, racism, the protests, and also like what are some of the longer term things Michigan should be putting in place to sort of address it so that next time we don't see these racial disparities emerge?
Yeah, so that's a great point. I'll say it's first of all important to note that if you're going to address these racial disparities, you have to understand where they come from. And they have nothing to do with the actual race of someone. That's a social kind of human-made construct. It has everything to do with racism and the subsequent policies that are put in place because of people's racism historically. Again, it's just part of the history of this country. And so what does that mean? It means that communities of color have fewer access to resources, education, you name it. And also, again, it means that Black people, especially in this country, can be murdered often without the repercussions that would serve justice. And so I think it's really important to understand the construct. I really understand and appreciate and support the protests that have happened all across the country. I think it's important that people are able to and do civically engage to move policies forward so that everyone, regardless of your race, religion, gender, everyone has a right to live healthfully across the country. And so I really, really think it's really important. I think moving forward, what do we do? Again, we have to address racism, address social determinants of health. Do people, regardless of their race and ethnicity, have equal access to housing, healthy housing, affordable housing, healthy food, affordable healthy food? Do they have access to transportation? Again, all of those things that really determine health outcomes, we have to really focus on that, or else we're going to continue to see the disparities that we've seen with COVID and before.
Will you tell us a little bit, as we're wrapping up, we've got you for about 3 more minutes, just tell us a little bit about your career path. And did you always see yourself working in government? Did it sort of come as a surprise? And we've got a question that's sort of related to this, as everything is changing. So tell us a little bit about your career path, and maybe for some of our students on the line, what are some of the skills or some of the specialties that if you were talking to a group of MPH students, public policy students, social work students, you would say these are maybe some things to consider building into your portfolio?
Yeah, so thank you for asking. I'm not sure, when I first decided I wanted to be a physician when I was in, I guess, high school, I didn't even know this type of job existed at that time. And so I certainly didn't think I would be here. But I'll tell you, as I went through my medical training, what I realized is you can only do so much by interacting with individual patients. The patient who's coming in with high blood pressure, stroke, you can only do so much with tailoring their medications. It's really what's going on outside the healthcare system where it really it impacts their health. And so I made a decision at the end of my emergency medicine residency that I really wanted to have a significant part of my career be in public health and health policy. And then fast forward, I got kind of tailored training in that and ended up as the chief medical officer of Baltimore. And then, as you said, kind of fast forward, here I am now. I think what's really important for students is that, one, they not necessarily focus on the job title that they're looking for, but they actually focus on the type of work that they want to do, the type of impact that they want to have. Think about, it's not just about what you learn in a classroom, but a lot of this work is about relationships and stakeholder engagement. It's often funny when I work with students, in my job, in previous jobs, who have just gotten out of their Masters of Public Health programs, they often get surprised because they may have a journal article or, there's 30 pages of literature that they want to give to a policymaker to tell them, well, you should just do this because it's what the evidence shows. Right. Well, there's a lot of other context. There's stakeholders, there's budget, there's not infinite amounts of money. So you have to think about how it's going to be paid for,
the opportunity cost.
The opportunity cost, exactly. So those are the type of things that I would hope that public health and social work and other students would get and learn about in their training.
So when I think about your trajectory, you really came to want to try to impact things on a systems level. And so that's where government gets attractive, to be able to say sort of not just a patient, but the context of every person serving that patient.
Exactly.
And
I really enjoy it. I still work in the emergency department at Henry Ford Hospital.
Oh, do you?
Yes, I do. I enjoy it. I enjoy teaching residents and working with the team. And it also keeps me grounded and helps inform how I think about policies at the state level.
Dr. Khaldun, thanks so much for spending time with us. It was really a pleasure, and we wish you well on your work. And actually, I think we're going to get you back in a few weeks for a response to Nicholas Kristof's book. So really excited to have you back for that as well.
Absolutely, I am as well. Thank you for having me.
Okay.
Bye.
Trevor, you're on mute again.
Thanks, Luke.
There you go.
So we're waiting for Lieutenant Governor Gilchrist to join us. Luke, I wonder if in the intermediate time you might just say a couple of things of a couple of ways that you've kind of worked at Poverty Solutions to address COVID.
Yeah, I mean, I think I appreciate we learned a lot, right, from talking with Dr. Khaldun about just thinking about state government and the type of role she's in, just all of the different things that she has to be an expert in, right? She has to be an expert in supply chains and the stuff and getting people the stuff. She has to be an expert in the science, right, in the medicine, and then has to be sort of a master negotiator and sort of be able to a mediator, right? Somebody who can work with all sorts of different stakeholders across the state. I think this, I'm going to send this piece on the sort of dramatic change in cases in the city of Detroit and how we went from overrepresented among cases to below average in number of cases and deaths. And I think that's a tremendous achievement that we should be proud of. And Lieutenant Governor Garlin Gilchrist, I believe, was a part of that. So it's such a pleasure to have you with us. And, you know, I'm such a big fan of both you and Dr. Khaldun, and you in particular. Since you were coming on, I actually put on a tie for maybe only the second time during COVID. So it's a treat. I'm not going to go through your full bio, but let me just introduce you a little bit. Lieutenant Governor Garlin Gilchrist is a graduate of the University of Michigan College of Engineering, Go Blue. He had a successful career as a software engineer at Microsoft, helping to build SharePoint in one of the fastest growing products in the company's history. He served as a social media manager for the 2008 Obama campaign in Washington State, and 3 years as a national campaign director at MoveOn.org, where he spearheaded equity and justice campaigns, including fighting to expand Medicaid in states with Republican governors like Michigan. This eventually led to him serving as the first ever director of innovation and emerging technology for the city of Detroit, where he used public data and technology to address everyday concerns the community was facing, including an app to report issues such as broken fire hydrants, potholes, and broken streetlights. Lieutenant Governor, it's a pleasure to have you with us.
Thank you so much, Luke. Always a pleasure to be here with you. And Go Blue is absolutely right. I'm in Lansing a lot. I got to deal with a lot of Michigan State people. Governor.
Well, it's great to have you. Great to have you back home here, at least virtually. So I believe that Lieutenant Governor is your first position as an elected official, way to start big, and following this career that you had both in the private sector and in organizing and then in an administration at the city level. So before we talk about COVID and before we talk about everything that's happened in 2020, what was it like to transition to a high-profile state office? Did anything surprise you? What were some of the important levers that you can pull that you sort of learned about, or maybe you were excited about going in?
Yeah, this was not in the plan. I guess let me let you know that. I think the biggest thing for me has been the transition for my family. So my wife and I, we have 3 children now. We had twins when I took office, and I ran for local office in Detroit in 2017 unsuccessfully to be the election administrator, incidentally. And but coming into this office, just, you know, Michigan's a really big state. Like, people sleep on that Michigan is the largest state in the country east of the Mississippi River. We're the 10th largest state by population. There are 10 million people roughly in the state of Michigan. I hope all of them are counted in the census by the end of October, in case you haven't filled out your census. Yeah. But so as a child, I was not exposed to most of the state of Michigan. I had a fairly typical childhood as a kid who lived in Detroit and in Farmington, and I didn't really go north of Lansing. The only reason I went to West Michigan was to play basketball tournaments in Kalamazoo. And so I saw much of the state for the first time as a candidate for lieutenant governor.
Wow.
And that's been really great because now in this role, I get a chance to show my children things that I had never seen before and expose them to all of the beauty of our state. I think the other piece is that, I got a great partner. I work alongside Gretchen Whitmer every day. She's a fantastic leader and an example and friend. And, days like today, yesterday, folks may have seen the news where there was a pretty,
I think everyone has, yeah.
Pretty dangerous, domestic terrorist gang plot to not only kidnap her personally and to execute her, but also to try to overthrow the government and take the state capitol hostage, including people like me. So I think the thing that has really heartened me, though, is as I get a chance to travel the state in this position as someone there's never been somebody like me in this position. People are very welcoming to me and recognize that I want to hear from them and respond to their needs. And so that goes the same true up north, Upper Peninsula, West Michigan, the Thumb, everywhere in between. And so I'm trying to bring my full self to this position. And Governor Whitmer asked me to do that when she asked me to be her partner. And so that has helped me in my first time here in service.
Yeah, and I just want to say that so many of us in Michigan, whether they voted for you and Governor Whitmer or not, are, we're with you on this and, thinking about you and how it doesn't represent Michigan.
Yeah, certainly. We appreciate that. We've seen and felt that outpouring of support, and just know that we're going to continue to do the work that we believe we were elected to do, and that includes, dealing with and working to eradicate the persistent poverty that has plagued too many communities in our state, and dealing with the disparate outcomes when it comes to health and educational opportunity and economic opportunity across racial and ethnic lines.
You mentioned running for a local office, and I just wanted to follow up on that. As I recall, that was one where you didn't win, but you actually got pretty darn close. And I was wondered about that. And sometimes getting pretty darn close actually is a pretty big deal. And when did you first think, hey, maybe I will run for office?
Yeah, I didn't think that until, honestly, it's come full circle. So I didn't think that until after the election results in 2016. This was a state that the margin of victory for the president was 10,704 votes.
Yeah. That
equates to 2 votes per precinct in Michigan. So every vote matters. And I really felt that if we had a well-run election administration operation in Michigan, that more people would have voted. And for me, politically, if more people would have voted, I think that Donald Trump would have lost. And so people encouraged me to run to be that election administrator. They thought that my combination of technical experience, project management experience, community organizing experience, working on voting rights stuff, they thought that I was like a good mix. Politically speaking, it was ridiculous. Like, I wasn't connected locally. I had never been to a party meeting or didn't volunteer for stuff. Because I got out of politics when I came home. Like, I was in politics in DC. I got out of that. Like, I detoxed completely. And so,
interesting.
Yeah, and so
we're planning on going back.
No,
yeah.
I didn't come home to run for office. I did not do that. And so, but these folks approached me, and so it took a couple months for my wife and I to decide that this was a good idea. And then I went all in. And was able to earn the support of an amazing group of volunteers to help run this campaign. And what ended up happening, it wasn't unprecedented. I mean, I was running against a 3-term incumbent who also is the person who counts the votes. And I ended up losing 1,486 votes in an election of 100,000 votes cast in Detroit. But the most important thing was I learned a lot about myself, a lot about people, a lot about our communities. And also I met Gretchen Whitmer during that campaign. We didn't know each other before. I actually met her on Labor Day of 2017 when we both were candidates. And so that's what ultimately, sowed the seeds for the relationship that led to our partnership today.
So you were really sort of inspired by events to do something, right? And to take a jump into a terrain that you weren't planning to go in.
Right. Yeah, this was not in the plan.
Not in the plan.
The plan, I'll tell you the plan.
Oh, yeah, tell us the plan.
So the plan was to, I was a double engineering major, software developer. I was going to go work for Microsoft. I worked for Microsoft for 5 years. And I was going to quit. I was going to go to business school, either back at Michigan, which I think had become Ross by then, but back in Michigan, and then I was going to go to Stanford. And then I was going to, with that degree, look, I actually only applied to 2 colleges in undergrad. I only applied to Michigan and Stanford. So like, for whatever it was, I was always between those. Anyway, so then I was going to, come home to Detroit and start a business. Like, that was the plan. And the plan fell apart because I didn't want to go to grad school. But nevertheless, my experiences have prepared me, I believe, for my service. And so being present in your experiences is something that is one of the key takeaways, I think, from my life and career thus far, because you never know what you're being prepared for. Yeah. And I thought I was being prepared to be the Detroit City Clerk, but I was being prepared to be a leader at such a time as the one we're living in right now. So yeah, here we are.
Well, take us back before we really talk about spring 2020 forward. Take us back to before that. What were you working on, and what were some of your priorities and the priorities of the Whitmer administration?
Yeah, so I mean, administration overall, we're focused on, we really want to just like do the practical things to solve people's problems: education, infrastructure, healthcare, and water. That's what we ran on. Fix the damn roads was about infrastructure. Access to education equitably was something that we ran on and championed, and the fact that every Michigander in the Great Lakes State should have access to water that's safe. That's what we ran on. That's what we won on by 10 points, to keep putting perspective. So the president won Michigan by 10,704 votes. We won Michigan by 10 percentage points, 400,000 votes 2 years later. So that's our sort of overall goal. Now, within that, I actually obviously have specific interests within our administration, and they have to do with this broad concept of connecting our communities. I'm a big believer in that everyone should have access to the internet. I want Michigan to be the first state to connect all of our people. So we have challenges to address when it comes to literal internet build out, internet affordability, and digital literacy. And so I'm working on that. And actually in what was lost in the news from yesterday was that we actually announced a pretty significant rural broadband grant program and a new Connecting Michigan task force that I'll be leading on ensuring internet access for all Michiganders. Another thing I was focused on is connections through transit and transportation. I have the unique experience of being a full-time exclusive transit rider before being a public official, like literally. Like when I got the call, when Gretchen Whitmer called me officially and asked me to be her running mate, like the campaign had to come pick me up from Ann Arbor, where I was working at the time, because I didn't drive there. Like I took a Greyhound bus from Corktown to Ann Arbor every day when I had to come to work on campus in the school.
Not the Wolverine shuttle we had.
The hours weren't great for me for the shuttle.
That's what I've heard.
Yeah, and
we've
so
been working on that.
I took that sometimes, but more often than not, I was at the behest of Greyhound, and that was a mess. So I'm a big believer in regional transportation solutions that will provide fast, affordable, safe public transportation solutions here. And I didn't have a car for 2.5 years in Detroit with my wife and children. So I've lived that life and really think that should be available and workable for all people. I spent the most time, and I didn't anticipate this coming in, spent the most time actually on efforts to reform our criminal justice system. I was the co-chair of our task force on jails and pretrial incarceration with Chief Justice of the Supreme Court, Bridget McCormack, also U of M faculty alum in the law school. And we look to reform our county jail system and reduce our jail population. It's the front door to mass incarceration. And people who even spend one night in jail can see their economic reality destroyed. But 50% of people are in jail in Michigan pre-trial. 50% of people are in jail for something to do with a suspended driver's license. People are in jail for failure to pay, failure to appear. And that's devastating on their economic opportunity and trajectory. And so we put in place, we worked with Pew Charitable Trust and partners to do the most comprehensive assessment of the state, of the county jail system in our state. Made a series of 18 legislative recommendations in January, and those have those bills that reflect those recommendations have had hearings in September. We expect them to be passed, many of them be passed into law during the lame duck session of this legislature. And then the last one I guess I'll mention for sake of time is something called Clean Slate. So I led a tour last year called Thriving Cities, which went to 19 cities across the state of Michigan, including Ann Arbor, and asked people, how do we improve quality of life in cities? And we looked at 5 areas: generational economic opportunity, kids in cities, transportation and mobility, environmental quality and justice, and fair and affordable and accessible housing. And the thing I heard in every city was this question of clearing people's criminal records, giving people a chance to fully participate in the economy. Well, about 2 weeks ago now, and yesterday, or 2 days ago, this was signed into law officially. The state of Michigan now has the most expansive and progressive program will be implementing the most expansive and progressive program to automatically clear certain offenses from people's criminal records that will truly unlock economic opportunity possibilities for hundreds of thousands of people in the state of Michigan, and will do so without them needing to hire an attorney or spend money to be able to actually get the jobs that they are
Wow.
positioned to get. So I'm very proud of that work, and that was work that combined, again, my technical background, because that is a systems problem as well as a policy problem. And so these are some things I was working on before the pandemic, and a lot of that stuff has been quite relevant during the pandemic.
Yeah, I think a certain former vice president might say that's a big bleeping deal. So congratulations. And I think just thinking about the what you were doing, it sounds like in both cases you are looking at a big problem, right? I'm thinking mass incarceration, and then looking for places where you can intervene, right? Maybe something that's been missed. Thinking about jail, not sort of prison sentences, but the front door, and then figuring out very concrete, tangible things that you can do about it.
Yeah, and I mean that's the engineer in me, Luke. Like I'm a problem solver by nature and by training, and so what we have a lot of big challenges. But something I learned both from my engineering training, but also from actually my work as a community organizer, is you always have to ask yourself the question, like, what can I do today? Like, how can I make progress toward a solution today? What's the thing that we can do right now that will make a difference and have an impact and get us closer to the vision of the future that we are seeking? And so I think about that. My team thinks about that every day, and I'm blessed to have such an amazing team working alongside me to help get some things done for the people of Michigan.
So thinking both about the long-term picture, but also just what happens today, what happens, what are all the pieces that I can move to get towards that bigger vision? Yeah,
absolutely.
Tell me about, let's talk about just when the COVID pandemic emerged. What was it like to be a leader in the state during that time? What is your work is focused on since then? Sort of what are some of the biggest issues related to COVID that have emerged in your portfolio?
Yeah, I mean, that sort of construct you just described in terms of thinking about how do we, at the same time, this duality of the responsibility to both long-term progress and short-term impact has been really the crux of what I've been working on during the pandemic. Before, I'm sure Dr. Khaldun will be able to speak to us even more, but before we even had our first confirmed case of this coronavirus, we worked to instrument our public health infrastructure to be able to collect data on race and ethnicity, because we acknowledge that racial disparities have been present in health outcomes for a very long time. And so under her leadership, we worked with local health officials in our hospital systems to be able to collect that data and information, and became, in the beginning, one of the first states, and sadly one of the few states still, that actually reports our demographic data that includes race and ethnicity on coronavirus cases and COVID-19 deaths. That's important because as we reported that from the beginning, we saw that these disparities in the mortality rate have been present. And so that is why Governor Whitmer signed into a law the executive order on April the 11th, I want to say, the creation of the Michigan Coronavirus Task Force on Racial Disparities. That's 1 month and 1 day after our first confirmed case. She asked me to chair that work, and we had 2 charges. The first was to address the mortality rate disparity in COVID-19. To give you an example, Black people make up 14% of the state's population, 13.6, and accounted for 41% of the deaths in the first month of the pandemic. As staggering. And so we needed to address that in real time because people were getting sick and dying every single day. I've said publicly on many occasions, and this is, sadly, you've seen this increase as I've said it, but I know 23 people who have died of COVID-19.
Mm-hmm.
And so we needed to deal with that and the immediacy and the urgency of that.
Can't be a plan for like a year from now. It has to happen today.
This had to be a different kind of task force. A lot of times, look, I used to be a community organizer. Like typically when elected officials said they're going to appoint a task force, that's them literally kicking the can down the road, right? But this was, what can we do right now? And it was very important. And so having people, the 26 people who stepped up to serve on that task force alongside our state government agency leaders have been extraordinary. Medical doctors, public health professionals, labor leaders, faith leaders, educators at every level, parents, young professionals, young people have stepped up to have these great ideas. The second charge, though, was to connect the learnings from the interventions to the long-term work of addressing and eradicating this. And so I've been focused on that quite a bit. I guess the other piece, we'll probably come back to that one, but the other thing I've been focused on are internet access. This pandemic showed how deep the disparities are in access to the internet across our state. 600,000 children did not have access to an internet-enabled device in their homes, according to the intermediate school districts in our state at the beginning of the pandemic. 60,000 kids, according to the school district, did not have access to the internet at all at home. And therefore, they literally could not do learning at a distance. And so I focused on organizing internet service providers and device manufacturers to literally make things available to people in Michigan, households in Michigan, so kids can have access to the internet to be able to learn. And then the third piece that I was focused on was the fact that our smallest businesses have been so devastated by the economic impact of our federal COVID-19 failure, frankly. And so how can they have supports, whether it was through things like the well-intentioned but horribly executed Paycheck Protection Program, to at the state level, our small business restart grant programs, the sort of Pure Michigan Business Connect matchmakers that can connect suppliers, particularly minority and women-owned suppliers who are making PPE and hand sanitizer and stuff to the businesses that need them for the purpose of reopening, and just support for our smallest entrepreneurs. I spent a lot of time on that before the pandemic. How can we make sure that the entrepreneurial resources that are available in Michigan are truly accessible to a broader set of people? We have really good resources, but they don't feel accessible to everyone. They don't feel accessible to Black entrepreneurs and to women, and to our elders, because of the stereotype that entrepreneurs are young hotshots, not people with experience. So making sure that those resources were available to people during this pandemic is something I continue to prioritize too.
So this summer, following the killings of George Floyd and Breonna Taylor, protests erupt all over the country and here in Michigan. I wonder if you could talk a little bit about how you see the role of state government in this, and what are some of the things state leaders can do to respond?
So, all right, y'all got to watch me while I'm walking because I'm changing venues to a car. So recognize first that we do have to reimagine how we deliver public safety in our communities. We have to do that. It has not been working. And I'm saying this as a Black man who has had unfortunate experiences with law enforcement since I was 9 years old. And I've talked very publicly about that because this is not the type of thing that you can achieve or elect your way out of. And so we need to be mindful of that. Second thing is that we need to recognize that a lot of decisions about how law enforcement actually works are made at the local level, the municipal level, and the county level. So therefore, at the state level, we have a responsibility to, I think, set a vision and set standards for how law enforcement professionals do their work, recognizing that their work is important to our communities and needs to be valued properly. And then also what kinds of investments that we can make around the sort of things that exist in parallel to law enforcement that can deliver a true sense of safety. Because I would think about it in terms of an analogy. Well, not an analogy, but this is an example. If you were to close your eyes and think about the time you felt the most safe in your life, maybe it was at a table with a family member. Maybe it was, again, nuzzled up with someone you love, whatever. And then you think about were the police there? They probably weren't, right? So therefore, so safety is a much more holistic concept than just the work of law enforcement professionals. So we need to think about how we invest in that. Now, having said that, I talked about we have a responsibility to set standards. And so what we've done through executive action and have called for legislation on things like there is a Michigan Commission on Law Enforcement Standards, where we are calling on them to do things like implement implicit bias training for law enforcement professionals, where we're calling on them to, we've actually expanded the board to include more civilian oversight on law enforcement professionals and standards. Can we work towards accreditation of law enforcement agencies that will include things like training and mental health check-ins with professionals and things like that? We also have called for legislation that will do things like banning choke and carotid holds and other sorts of things. Creating tracking for officers who have had bad behavior. And having that be shared across the board and things like that. So there's a lot of work that can be done policy-wise to evolve how law enforcement works. And we have been doing this in Michigan. We've been lucky to be able to do this in partnership with law enforcement. And so I think that we have an opportunity to be a leader in this space as well.
Lieutenant Governor, I have like 3 more questions for you. Are you good or?
Yeah, I'm good.
Okay, great.
There's gonna be some motion on the video. This is real life.
Okay. That's right. Yeah, this is a moment in the life of Lieutenant Governor. Could you, Abby was asking about just elaborating a little bit more on plans for digital literacy and internet access for all Michigan residents. What are some of the biggest roadblocks and, the tools to really make this come to fruition?
So, I think the first thing to think about is that we have to recognize that the problem looks different. Let me get this light a little better. The problem looks different in different communities. Yep. In some communities, the problem is like access in a very literal sense. Like there literally is not internet service available to you. And so part of that is an infrastructure problem. Part of that is also a business model problem. Like it's very hard to like be a rural internet service provider that's providing these services in a not very densely populated region. So thinking about innovation in those business models is important. Second thing might be affordability, where you may see in some of our more urban areas like Detroit, where people might have access, but they need to be able to actually afford this in their day-to-day lives. Mm-hmm. So what kind of innovation can happen? And this is partly a business model question, but mostly an offering question. What can we do to make sure that there is an affordable option for people, regardless of where they live, that makes sense for them? And then the third piece that I think is important is digital literacy. I want people that once they actually have access to the internet, once they can afford it, to integrate it into their lives, how then are they able to make sure that, like, can they take full advantage of it? Yep. The internet, you can do a lot of stuff on the internet. Entertainment, education, jobs and opportunities, healthcare services. That's something else that's been super important during the pandemic, telehealth, medical services. And so making sure that people actually have like the skills and the tools to be able to do all of that requires an approach to training and education so they can have it. So I think those are the things that we're going to try to solve in Michigan, because doing all 3 of those things is what's going to take to be the first state to connect all of our people. But that is my ambition, to have us be that state.
All right, last question. What advice, any small advice here at the end you would give for U of M students who are interested in a career path like yours?
So my path is winding and non-traditional to public service, obviously. So, but I do think it is important that people, something that worked for me is the fact that I think, I had learned and seen things across a number of sectors. Although I'm young, I've worked in the private sector. I have been an entrepreneur a couple of times over. I've worked in the public sector at the municipal level. I've worked for nonprofits. I've served on boards. I've been a community organizer and an advocate. So like I've worked in higher education. I worked in the School of Information at the University of Michigan.
That's where I met you.
So exactly. So I've had a bunch of different experiences that I think have combined to give me a unique perspective on public service. And so what I would encourage people to do is to be fully present in your experiences that you're doing, because it may not be clear, because I told you I had a plan and that plan didn't really work out, but all those experiences have prepared me for this service. Mm-hmm. And so there is a distinction between planning and preparation that you should be mindful of, and that can truly set you on a path towards success.
That's a great place to end. Lieutenant Governor Gilchrist, thanks so much for taking time with us today and sharing your insights. And and just best wishes with your work.
All right, thanks, Luke. Y'all take care.
You too. Okay, everyone, we're at 1 o'clock, and hey, I had a really good time. So I hope you did too. And just thinking about the work that they did, and also thinking about the framing of the work, right? And problem solving, and think about how you take big challenges and sort of break them down and into ways that can really improve people's lives. So thanks so much for joining us. We got some great sessions coming up. So check out our website, poverty.umich.edu. Keep on coming back, and we'll look forward to seeing you again.